Rosemary, one of my personal favorites. Rosemary is widely popular and a diverse herb with a variety of applications, both in industry, such as the fragrance industry, in cooking, and also in herbal medicine. It's also known as Rosmarinus officinalis, and it's native to the Mediterranean. Thus, it was highly prized by the Egyptians, the Greeks, and the Romans. It was also valued by the Europeans and people in the New World because of its known healing prowess. There are many health-promoting compounds within rosemary, but these compounds fall into one of three categories. Number one, terpenes. Terpenes are fat-soluble, volatile compounds that are the primary constituents of essential oils. They are also known to have anti-inflammatory, antioxidant attributes. They are often responsible for the characteristic smell and taste of various plants. In rosemary, the most important terpenes are cineol, camphor, and pinene. Number two, polyphenols. Rosemary also contains a diverse array of polyphenols, such as phenolic acid and flavonoids. Polyphenols are natural compounds that are produced by plants to help protect the plant against harsh conditions such as UV radiation damage and damage due to parasites or disease. When you consume polyphenols, we as humans get some of the goodness. Many studies suggest that the critical components of nutritious foods such as berries, kale, and spinach are their polyphenol profile. An important polyphenol in rosemary is a phenolic acid called rosmarinic acid. Number three, polyphenolic terpenoids. A type of substance that's unique to herbs and spices and is found in high concentrations in rosemary is something called a polyphenolic terpenoid. Now, polyphenolic terpenoids, as the name would imply, is taking a polyphenol and taking a terpene and kind of merging it together. So you have this powerhouse, this dynamic duo of nutritious benefit. These types of substances have been shown to have powerful anti-inflammatory and antioxidant properties. While rosemary has a few different types of polyphenolic terpenoids, most investigators believe that the two most important are carnosic acid and carnosol. So how does rosemary promote musculoskeletal health? As noted before, rosemary demonstrates potent antioxidant attributes. Oxidative stress, free radical damage, is a driving force behind premature aging to your whole body, but it has a special place for targeting bones, muscle, tendons, and ligaments, and the joint. So oxidative stress is a bad thing, and anything that can compromise, thwart, sabotage oxidative stress is good for the musculoskeletal system. Since rosemary has so many types of substances, a diverse array of health-promoting compounds such as terpenes, such as polyphenolic terpenoids, and polyphenols, it can thwart oxidative stress through many pathways and on many levels. The compounds in rosemary can sabotage oxygen-free radicals. They can neutralize nitrogen-free radicals, and they can also quarantine or disrupt heavy metal toxins. Some research even suggests that if you look at all the herbs and spices, potentially rosemary is the best at counteracting oxidation and free radical injury. Rosemary also exhibits anti-inflammatory properties. Chronic low-grade inflammation is a driving force behind disease. Imagine if you have an acute injury, then inflammation is very important to break down structures that are injured and then initiate a process to build new healthy structures. However, if this process is going on all the time and all the time, you get something called collateral damage. Just like in war, there's collateral damage, and also when the body's trying to heal itself, there's collateral damage. And so if you have inflammation constantly going on, a lot of healthy structures that aren't injured, that don't need to be repaired, are damaged. And this can, one, initiate, and two, more commonly, potentiate any type of injury to the musculoskeletal system, such as injury to bone, injury to muscle, injury to tendon, and injury to ligament. Rosemary and its diverse array of health-promoting substances helps minimize chronic inflammation and helps the body rebalance itself so it has a healthy amount of inflammation that's appropriate to promote well-being, as opposed to potentiate injury and an unhealthy state. Rosemary can attack chronic inflammation on many levels. It's been shown to inhibit or decrease the synthesis of many signaling molecules such as tumor necrosis factor alpha or interleukin-1. These types of signaling molecules ramp up the immune system and again aggravate and magnify inflammation. Rosemary has also been shown to inhibit nuclear factor kappa beta, which is a transcription factor. What transcription factors do is they selectively open up your DNA and figure out what types of things that the cell should produce. Now this transcription factor in general produces things that promote inflammation and that leads to injury to musculoskeletal structure. Rosemary has also been shown to inhibit the production of an enzyme called COX-2. COX-2 is an enzyme that produces substances called prostaglandins that cause pain, inflammation, and swelling. COX-2 enzyme is a target of many common anti-inflammatories such as Motrin, ibuprofen, and so forth. And so rosemary has the potential to serve a similar role to these anti-inflammatories, except it's more of a natural compound. Rosemary also demonstrates anti-fat attributes. Obesity is a significant patient-controlled risk factor for chronic joint injury and disease. Rosemary has a high concentration of a substance called carnosic acid. Now, carnosic acid has been shown to decrease the function of an enzyme called pancreatic lipase. Now, pancreatic lipase is the enzyme your body uses to break down fat. So the logic is well, if you have an enzyme that breaks down fat that's not functioning, maybe you can't absorb as much fat. So potentially rosemary decreases the absorption of fat and thus reduces your risk for chronic joint injury. Rosemary is generally considered safe when consumed in usual culinary doses, which is 1 to 3 grams per day. But any consideration of supplementation or taking rosemary in a concentrated form, please consult a qualified medical professional who's familiar with your unique medical history and can advise you wisely.